Thank you. Good afternoon, everyone. I'm Congresswoman Alma Adams, and I'm so honored to represent the 12th District of North Carolina and to be the co-founder and co-chair of the Black Maternal Health Caucus. I really want to thank the March of Dimes for hosting this important town hall event. Clearly, now is the time. I'm so excited to celebrate the March of Dimes' new blanket change initiative, a massive advocacy campaign to encourage policymakers to make equity, access, and prevention to improve health outcomes for mothers and babies a top priority. So, thank you for your commitment to improving outcomes for all birthing mothers, persons, and babies, and especially Black moms and babies who remain our most vulnerable. The pandemic has underscored just how much more than ever the urgent need for everyone to have access to culturally competent and quality care. I look forward to the discussion.
Thank you so much for joining us, Congresswoman. I wanted to start off by asking what led you to co-found Black Maternal Health Caucus last year, and if you had kind of a personal connection to the issue.
Well, thank you very much for the question. For me, like countless others who are dedicated to this effort, this issue is really very personal to me. My focus on Black maternal health began when my daughter survived a complicated pregnancy that almost claimed her life and the life of my grandchild. So when I got to Congress, I knew that I had to make this a priority. And because my daughter and grandchild are not alone in their experiences, I thought this was important for the caucus to take on. Now, across the US, Black mothers are needlessly dying during what should be one of the most joyous times of their lives. And as you know, the US is one of only 13 countries in the world where the rates of maternal mortality and morbidity are worse today than they were 25 years ago. And so we continue to have the highest maternal mortality rate among wealthy countries because of the disproportionate death rate of Black mothers. Research shows also that the cumulative stress of racism and sexism undermines Black women's health and making them more vulnerable to complications that endanger their lives. To make it worse, the significant health disparities that Black mothers and infants already face are further exacerbated by COVID-19. So Black maternal health in this coronavirus era is truly a crisis within a crisis. It's absolutely critical then that we provide mothers and birthing persons the support that they need before, during, and after pregnancy. And that includes access to nutritious foods, paid leave, maternal health services, quality postpartum coverage, and a clean environment. So earlier this year, Representative Underwood and Senator Harris and I introduced the Black Maternal Health Omnibus Act of 2020, which is a package of 9 bills which build upon these concepts so that we would, through the Omnibus, diversify our perinatal workforce by investing in doulas and midwives and other community-based providers, extending the WIC eligibility for the postpartum period and for the breastfeeding period, and then to establish a grant program that would implement trainings on bias and racism and discrimination in maternity care, and so much more. So this Momnibus, with this, we've designed a roadmap. That's what we look at it as, a roadmap to ensure that our healthcare system provides regulators, lawmakers, and society get them to the point where we finally make Black maternal and infant healthcare a priority.
So you touched on this a little bit already, but what has Congress kind of been doing to address maternal mortality rates this year, especially given the impact of the COVID-19 pandemic on healthcare?
That's a great question. You know, last month, the House passed an incredibly important maternal health equity package, the Maternity Health Quality Improvement Act of 2019. It's a bipartisan bill, and it has much of my Maternal Care Act, which funds training for healthcare professionals on bias, implicit and explicit, as well as provisions to improve maternal and obstetric care in rural communities. And so if it's enacted, it would be a critical step to end preventable maternal mortality and eliminate racial inequities in maternal outcomes. Another one of the most important impactful changes we can make to support maternal health is to expand Medicaid postpartum coverage from 60 days to a year. So earlier this year, we passed the Helping Moms Act, which will allow states an option of providing that needed 1 year of postpartum coverage under Medicaid, as well as under the Children's Health Insurance Program, or CHIP, as we call it. Unfortunately, though, the Maternal Health Quality Improvement Act and the Helping Moms Act have only passed through the House. And as you know, it also must get through the Senate before and on to the president before it becomes law. So we're hopeful that the Senate will take up these important measures before the end of this Congress.
So earlier this year, you mentioned the caucus introduced the Black Maternal Health Omnibus, and that combines a lot of different policy issues related to this issue. I guess, what are some of the challenges in getting that passed into law?
Well, as with any legislation, there are a number of obstacles, including, first of all, educating members of Congress, and that was one of the reasons that we put the group together. But educating members of Congress on the importance and the need for this legislation, that way we can garner enough support to get the bills to the floor. That's really important. That's one of the main reasons that we created the Black Maternal Health Caucus, and I'm proud to say that we have more than 100 bipartisan members. And with the blanket change initiative, I know that we will now be joined in our fight by even more partners. But even with strong support, some legislative efforts take years, sometimes decades, and we don't have that kind of time. Unfortunately, matters have definitely been complicated further by this pandemic. So the urgent need to address the devastating impacts of this pandemic, including its exacerbating efforts on Black maternal health, has taken up much of the legislative calendar, and rightfully so. So thankfully, the House has still made time, even given all that we're juggling, to pass multiple packages to improve Black maternal health. We have raised the awareness, but there's still a lot more to be done. And I'm hopeful that the Senate will also refocus on passing substantive legislation, including the urgently needed legislation that will combat the Black maternal health crisis.
So a common theme that I've noticed in a lot of the bills on this issue, and you mentioned it yourself, is that is to extend Medicaid coverage up to 1 year postpartum. And I'm just kind of curious, why is that a big priority? Why would that kind of help reduce the maternal death rate?
Well, multiple, as I mentioned before, the House passed the bipartisan Helping Moms Act. And of course, this allows states the option of providing the needed 1 year care of postpartum coverage under Medicaid, as well as under CHIP. And so this legislation, as well as the Mamas Act and other legislation to extend coverage for a year postpartum, is vitally important. So when we think about the Urban Institute, for example, recently found that almost 1/3 of women who lost Medicaid coverage and became uninsured in the postpartum period had conditions that require ongoing monitoring and care, like pregnancy-related hypertension. Also, 1/3 of new moms who lost Medicaid were recovering from a C-section, and over one quarter of them reported being depressed sometimes, or often always in the months after giving birth. So that's not acceptable to us. So we've got to provide quality postpartum healthcare coverage for all birthing persons and mothers and infants, and we've got to allow them to fall into the coverage gap at such an incredibly vulnerable time. Allowing them to do that creates a problem for themselves and their babies. And it also contributes directly to our nation's maternal health crisis. So it's really important that we extend Medicaid coverage to a year postpartum as soon as possible. We know, for example, that in the state of North Carolina, we did not expand Medicaid with COVID. The situation has been exacerbated. So again, I hope the Senate will consider taking up this bipartisan bill. before the end of the year, and so that we don't lose another mother, another birthing person, or baby to this crisis. This is so, so critical.
Thank you, Representative Adams, so much for joining me today. We're delighted to have a brief video message from Representative Kathy McMorris Rogers, who unfortunately could not join us for today's live discussion.